So, hello guys. I hope you're fine. And how was the paper? How many questions did you get from medicine today? And Dr. Srinath, hello to you as well.
Hello.
Okay. So, hello guys. I hope you're fine. And how was it? Please do post your recalls for medicine because I know it was a difficult day and a different day for you because you had two separate papers. But I think so the recall of medicine will always remain in your mind. So do share your recalls in the chat box so that we can start for that.
And as a feedback, paper was moderate, and there were a few repeat questions also.
Mhm.
All right, so there was one question on PSVT ECG. I think that was a image-based question, and treatment of PSVT was being asked. So PSVT, you must have seen the images many times, and also in your workbook that P wave is absent, rhythm is regular, patient has sudden onset of tachycardia. So if patient is hemodynamically stable, so we go for a carotid massage. And if there is no response with the vagal maneuver, that is carotid massage, then the drug of choice for PSVT is IV adenosine. And IV adenosine is repeated, and still there is no response, then we go for a calcium channel blocker. So if this was the correct recall key, what is the treatment of PSVT? Patient is hemodynamically stable, then a first step should be carotid massage. So you can recall this question. What was the type of the question which was being asked? Yes, anyone? Okay, so anyone can complete this question of PSVT? Yes. All right, so we are getting a recall on cardiac tamponade, JVP finding, treatment of rheumatic fever. Okay, so cardiac tamponade, JVP finding, as discussed in the workbook also, that the predominant JVP finding of tamponade is absence of Y descent and A wave will be prominent. So if these were the options given in the question, then these are the correct options: A wave large and Y descent absent, JVP. Indeed, cardiac tamponade is one of the large movement revision topic. Usually they ask question from these frequently asked topics of tamponade. All right, so Hemant, can you give the other options or JVP findings of JV in cardiac tamponade? From my side, it will be large A wave and Y descent should be absent. Y descent absent is characteristic finding in cases of cardiac tamponade.
Regarding the treatment of rheumatic fever, there was one question.
Okay, rapid Y descent. Rapid Y descent should be a false answer there in cardiac tamponade because Y descent is absent. Passive filling phase into the right ventricle is impaired. So rapid Y descent must be a wrong option here. Any other option? Yes, Hemant, you can recall further. All right, till then, treatment of rheumatic fever. So, treatment of rheumatic fever, it depends on ki what exactly was the question. If it is the treatment of acute manifestations like arthritis, then aspirin is the drug of choice. Yes, rheumatic fever, a drug of choice, it will be arthritis, which is a major manifestation. Aspirin in anti-inflammatory dose. 75 to 100 milligram per kg per day should have been the correct answer here. Or if prophylaxis is being asked, then prophylaxis will be benzathine penicillin every 3 weekly will be the correct answer here. And depending on the choices, so we can go for the aspirin as the correct answer here. Yes. Okay, so the next question, FeV1 is less than 70% of predicted value. So FeV1 is less, that means it is obstructive airway disease. So bronchial asthma, fibrosis. So yes, Dr. Srinath has mentioned the answer as obstructive lung disease. All right. So you can, students, you can recall full options here.
What is the next question? Srinath, can you help us for this? Patient with red jelly current sputum, what is the treatment? Can you elaborate the option, Dr. Hemant, for this red currant jelly sputum? What is the treatment? What were the options actually being given? Was it investigations or the, yeah, okay, OPD, antibiotics, IV antibiotics? Okay. Or ICU?
Red currant jelly, a Klebsiella infection. So, what were the choices for treatment options?
The options they were given were OPD antibiotics, IV antibiotics, or
ICU admission.
ICU admission.
But they had not given any clinical like curve criteria for severity. So, if it is just a typical pneumonia, I think OPD antibiotic is good enough. It is a typical case of pneumonia. Atypical pneumonia, if it was, we would have gone for macrolides. But just try to recall, Hemant, if there was anything more than this, the sputum alone is just a specific for the organism. But severity will decide whether it is OPD, ICU.
Yes, Hemant, you can recall if blood pressure was low given or blood urea nitrogen elevated, patient confused, or respiratory rate was high. So we can fit into the CUPS
Respiratory
criteria.
distress.
Yeah, yeah. Okay, Dr. Srinath, patient has altered sensorium.
As per the curve criteria, we have to.
Yeah, we have to go according to the CUPS criteria. Hemant, any age of the
An
patient?
altered sensorium. Yes. Yes.
That's why they have given ICU in the option.
Yes, almost certainly it will be ICU in the sense altered sensorium, patient requiring ventilatory support. because moderate is very rarely asked. It will be mild or severe. But if you can recall the age, we can get the age of the patient, elderly patient, BP low, altered sensorium. It will favor ICU admission.
So we have the answer finally. Okay. Any other recall from nephro, rheumat? We'll go system wise. Like
Yeah, any system you can recall, any CNS question on stroke, epilepsy.
Parkinson. Okay, we have the further recall for this question. 40-year-old with hypotension. Okay.
Yes, older sensorium with hypotension, I think CUP criteria will fit into ICU admission, most likely.
Yes, sir. There must be more like respiratory rate also must have been elevated. Yeah.
Mhm.
GTC is drug of choice. It's broad spectrum anti-epileptic, valproic acid. I hope that was in the option. If there were options like valproate, phenytoin, lamotrigine, and any other drug, you should always go in for a broad spectrum anti-epileptic valproate.
Yes,
So
option.
sodium valproate is the correct answer. No doubt on this.
So, students, you can recall, we'll give you the topics so that it will come in your mind. Ki, topics of CVS will be cardiac murmurs or valvular heart diseases, cardiomyopathy question, myocardial infarction question, any question on hypertension. So you can tell, and in GIT from liver, hepatitis B virus infection, any post-exposure prophylaxis for hepatitis B, serology of hepatitis B, Wilson disease, hemochromatosis, portal hypertension, ascites. So these are some of the stat and frequently asked questions from GIT. So if you can remember any of these topics from the today's exam, you can share your questions here.
Any question from stroke, Parkinson, one of the favorite topic, or even drugs of multiple sclerosis, anything of this sort?
Right. So I think we as a faculty can agree ki till now whatever question recall is there, these are stat questions, or you can say frequently asked questions, and easy. These are easy questions.
Lewy body pathology was given. Okay. Okay, so we're getting more recalls now. Lewy body path was given, Parkinson. So was it specifically asked as a question that Lewy body is seen in options? Number one is Parkinson. Second is even dementia of Lewy body can have it. Other disorders under Parkinson plus family that we've already discussed in the classroom teaching can also have Lewy body. So if there was an option like Parkinson, Alzheimer, any other degenerative like ALS, obviously Parkinson is a favorite answer there. Okay, so there's some elaboration in the question for GTCS. Repeated GTCS in 45 minutes. Okay. Okay. So can you elaborate the question? Was it the duration of the seizure that was 45 minutes? Or was it a repeat of the previous episode? after 45 minutes. See, because we have to look into the definition of status epilepticus in this question. Either the seizure duration is more than equal to 5 minutes or interictal loss of consciousness is more than equal to half an hour. So accordingly, we have to define. So can you give me an elaboration on this? Okay. There's one question on migraine. Patient had photophobia, unilateral headaches, aggravate on skipping breakfast, something options. Okay, so you have unilateral headache, you have photophobia as a symptom. Skipping breakfast means hunger. That is an important trigger for migraine. Even looking at the options, you can just clearly mark it as migraine. Because tension headache, they will always mention depression in the background with a dull aching, pain which is band-like. Cluster headache is male predominant with lacrimation and all that story of alcohol is there. So I believe this is a easy paper with easy clear answer migraine. Skipping breakfast is just a trigger hunger which can trigger migraine. Any other recall on Guillain-Barré syndrome, the favorite topic of the National Board of Examination? Or Brown-Séquard, Zehar wali खीर? Okay, the second paper was comparatively easy. I agree. It will always be easy because you read medicine very well and you might have been taught also very well. And this is something that becomes easy when you have well read the topic.
Any questions related to SLE, RA? Very means rheumatology, just two topics. No, SLE, RA, acute renal failure, chronic renal failure, or simple uremia related questions related to dialysis.
Okay, there was a history was given with image of Parkinson. Can you elaborate the history, Dr. Iram? Can you elaborate the history at least? Image, all we can just imagine then. And there was another question on myasthenia was given in the drug. What was that scenario of myasthenia? Was it regarding the normal symptoms or any crisis or some respiratory failure the patient was suffering from? Dr. Evans's classical scenario of myasthenia was given. They might have given you a symptom, patient complained of diplopia, ptosis, some easy fatigue on movement, and the drug they might have asked you, you have to mark the drug of choice, pyridostigmine, added with an immunosuppressant and plus minus thrombectomy. So if you can tell me the options, then it will be easy for a better discussion later stage. See, you are the people who actually gave the exam. If you tell us a brief outline on the question, we can ask the other students as well. And if you give us the options, it will be always better for a healthy discussion. Because in FMG, National Board, any exam that you come across, the question will never get repeated, the topic will get repeated. Okay.
See, and the thing is, the pattern is the very same as I think all three scenarios. If you see PSVT question treatment, whether it is pneumonia answer, whether it is myasthenia, we have repeatedly told treatment depends on severity. So PSVT in shock, you shock. If stable, you do carotid massage. When patient is in myasthenia crisis, it would have been IV steroid. So you have to please help us not just with disease. That's the common mistake students are doing, reading the disease and choosing one drug of choice. But that pharmac is gone. You have to look at severity. Once you give us severity, you will get the correct answer. I'm sure all those answer options were there.
Okay, there is one question, dehydration and four color options were given. So, what exactly was the question? Was the question is ki patient is in dehydration and which IV color cannula should be given? So, I think that should be the better answer here if four color options were given. Again, that depend on ki what is the severity of the dehydration. So, or if the color coding and the size of the cannula was asked, was that the question? So you can complete the question, Dr. Iram. Patient met with a road traffic accident. ECG was normal. Which shock patient is in?
Okay. Dehydration question. There was a skin pinch is going back slowly. Which color scale is
Scale
it?
that dehydration belong yellow, pink, green.
Like a very pediatric question.
Yeah.
Yeah. Okay, Dr. Rose, BP 90 by 60. 90 by 60 for which question? Question of dehydration or question of shock? And most likely, patient met with the road traffic accident, ECG is normal. So the type of the shock, it needs further clinical features like the status of JVP or whether it is low, whether it is high. So if other features of after road traffic accident it is given, then it will be better to know which type of the shock. Otherwise, most likely it will be hemorrhagic shock in a road traffic accident. Okay, BP was 90 by 60, so patient is in shock. If JVP is low, then most likely it will be hemorrhagic shock. Hemorrhagic shock. Okay, bradycardia was given. If it is a bradycardia, then it is neurogenic shock. Neurogenic shock due to road traffic accident, that can be a possibility. A road traffic accident on the chest wall injury can cause a tension pneumothorax or cardiac tamponade. So we need to know further clinical features for this type of patient who is coming in shock. Okay, ECG X-ray is normal. That means ki there is no tamponade, no pneumothorax, bradycardia. So bradycardia is most likely neurogenic shock, most likely. Okay, question on stroke. 4 hours ECG shows irregular rhythm. However, symptoms improve after 48 hours. So options were TIA, cardiac embolic stroke, thrombotic stroke.
So if the symptoms improve after 48 hours, you have crossed the duration of 24 hours. So it is not a TIA, it has to be stroke clinically. And since it was a irregular rhythm, that means it was most likely atrial fibrillation. That means the best answer should be cardioembolic stroke. Cardiac embolic stroke. A very clear answer and an easy question.
All right, so bradycardia hypotension is going in favor of a neurogenic shock. Most likely, it is a neurogenic shock.
Okay, seat belt injury is there. I think so in the same RTA question, they're telling this in seat belt injury. Okay, heel to shin test is done in which of the following system? So if they are asking you system, then it is obviously neurology. In neurology, we have to look in for a particular localization of the disease. Heel to shin is a test that looks in for coordination, and that is well maintained by cerebellum. So if the options were CNS, it has to be CNS as an answer. If they specifically asked you the localization, cortex, spinal cord, cerebellum, basal ganglia, it has to be in the cerebellum. The heel shin test. Okay, so there is one question from okay. Okay, they have given the options for the heel shin test as spine, cerebellum, pyramidal tract, extrapyramidal. Cerebellum is the best
Cerebellum. Yeah.
because extrapyramidal will be basal ganglia also. So we looking for coordination, for looking for the cerebellum. Okay, so during inspiration, systolic pressure reduces greater than 15, seen in all except cardiac tamponade or HCM.
Yeah, this is pulsus paradoxus, and pulsus paradoxus, most common cardiac cause is cardiac tamponade. So again, it is a straightforward question on cardiovascular examination. Yes, correct.
So the RTA question I think so is different from shock, and there is another question on seat belt injury. Which organ is likely to be damaged, liver or spleen? I think so. We'll talk to the surgeon for this. They will guide you better on that. This concept.
Yeah,
Okay?
trauma-based questions.
Trauma-based questions. Okay. So there was a question on DVT question. DVT question: deep vein thrombosis, prolonged immobilization. So what was the question like? Was it a patient who has an overall long distance travel by air, immobilized due to some reason?
For pulsus paradoxa, options were accept. Then HOCM will be the answer. It is not seen in HOCM. In HOCM, it is a reverse pulsus paradoxus. That is opposite of the pulsus paradoxus. So any questions on general medicine, like they ask these days vitamin deficiencies, uh, anemia questions, hematology questions. Okay, post immobilization, post surgery, after prolonged immobilization, sudden distress, respiratory distress, and tachycardia. So, if the prolonged immobilization is there, then the first answer should be pulmonary embolism with respiratory distress and tachycardia.
Okay, there was a question on aphasia also. Can you just elaborate the question? Gaurav on this?
There is also one question: patient has abnormal gait. Options were subthalamic nucleus,
Amygdala. Hmm,
Non-fluent aphasia.
Non-fluent is broadcast. It's a broken speech, telegraphic speech. Was the question like which of the following is a non-fluent aphasia? Then it has to be broadcast. Okay, non-fluent means in which the fluency of the patient is decreased. That has to be broadcast. Okay. Okay, one question on snake bite came. One question was when snake bite first management should be. Can you elaborate the options like tying a tourniquet, going for immediate assessment of the wound, or waiting for any other test to be done, or ASV was the option? Because snake bite can be different, and all the treatment depends on the type of the snake. Is it okay? After accident, there is an injury to the spine. Patient can't be able to sleep. Okay. So they were asking you about the localization of the sleep disorder. Okay, putting a tourniquet, yes, of course, that is the first thing that we'll try to do at the moment of the snake bite.
Yeah, and I think that question, correct answer will depend on the options given, and our FMT faculty can also discuss snake bite management. Okay, after accident, there is injury to spine. Patient not able to sleep. So, if you can elaborate this question. Okay, one question on hematology have come. Patient has tingling sensation on index finger. Serology was given as serum ferritin is low, TIBC is high. So ferritin is low is definitely iron deficiency anemia, and TIBC high is also seen in iron deficiency anemia. So this is the anemia symptoms.
Okay, next, there was an hysteresis picture with a 65-year-old patient presenting with it. Question asked which condition causes. Hysteresis means flapping tremor. That comes in failure of the liver, kidney, and the lungs. So you have to decide the options then. If all three were there, then answer will be all of the above. Okay, so can you elaborate the options for hysteresis? Like hysteresis, 65-year-old is due to stroke, due to Parkinson, something like that.
Okay, so asterisk question option, if you are saying hypercarbia, beta 2 agonist medicine, so high carbon dioxide will
CO2
cause
narcosis.
CO2 narcosis.
Will cause pulmonary failure, will cause CO2 narcosis, will cause hysteresis, any kind of encephalopathy. Beta 2 agonist, if you give, they will just cause tremors.
Tremors, yes.
Yes, but so a lot of CNS and CVS has come, some reasonable respiratory also, but no other baki GI, liver, rheumat, any antibody at all, arthritis, antibody, urea cycle. बस तो princess you are right irrespective है ना hypercarbia right here metabolic encephalopathy anything uremia CO2 narcosis your right answer
Yeah, it could be option all except. So that is also important.
Correct. That's how many tests will take and for what species? Option 3 and 1 aerobic, 2 anaerobic. अरे वाह, direct question. HLA B27, शाबाश. So है ना, खुशी का माहौल छा जाता है. All direct questions ही है sir. Not only just FMT notes, these are all from the FMG Express only. All the curve 65, HLA B27 positive disease, I think PSVT, all these are straight questions. AFib causing stroke, thromboembolic stroke. चलो बढ़िया. बोलो बोलो प्रिंस, आज आप तो भी खा रहे हो, बोलो फटाफट बोल दो ड्यूक्स क्राइटेरिया. How many test will
Okay, so question on Duke's criteria questions, if anyone can recall, major and minor.
yes, infective endocarditis. How to collect blood.
Okay, so options you can give. How many? मतलब कि what was the exact options?
Okay, for infective endocarditis, how many tests you will take?
Two bottle culture test should be taken with the 1 ml per bottle. So that will be the correct answer. So three.
They were asking about two tests, one for aerobic, one anaerobic.
Mhm.
Three set of sample, two for anaerobic, one for aerobic.
Okay.
Okay.
Mhm.
Like there were the options like this. Three set, two anaerobic, one aerobic.
Mhm. Three tests, two for anaerobic, and I think it will be two for aerobic and one for anaerobic, but it should be two blood culture sets which should be taken. So aerobic are given preference than anaerobic because anaerobic are less common.
Men, one question तो आना ही है.
Yes. So men, multiple endocrine neoplasia.
That actually they read in surgery.
Okay, men one.
Men one. Yeah, all men are not the same. There are men one, men two, which are A and B further. Okay. So there was a question on biliary atresia.
Okay, so that's a surgery question.
Surgery question.
Okay, rheumatic fever caused by there was no group A beta hemolytic in the options. Viridans streptococci, streptococcus pneumonia. Okay, rheumatic fever is beta hemolytic streptococci. Or was the question on infective endocarditis? Okay, amidron side effect. That is one of the favorite questions being repeated for last 5 years. Amidron side effects on skin, on thyroid, on lungs, pulmonary fibrosis. So lots of side effects. So if you can recall the options, we can give the correct answer here. Yeah, it would be infective endocarditis. Then infective endocarditis, then the answer is virulence streptococci. Because streptococcus pneumonia and group A beta hemolytic rarely cause infective endocarditis. Options were pheochromocytoma, parathyroid tumor, pancreatic tumor. So, men one is having parathyroid tumors, pancreatic tumors, and pituitary tumors.
Yes. There is no pheochromocytoma in the triad.
No view.
So parathyroid, pancreatic may be gastrinoma and this gynecomastia. Following not a side effect of amiodarone.
Okay, following is not a side effect of amidron. Yeah, side effect all except. Okay, amidron causes hyperthyroidism. It can cause hypothyroidism. So if they are asking endocrine disorders, so both these are the effects of amidron.
Yes, yes.
Pulmonary
Except
fibrosis, yes, pulmonary fibrosis also by amidron, and so all except will be gynecomastia. Hmm.
So any other recall on endocrine? Any question on growth hormone, prolactin, adrenal?
By what you rule out transudative origin in pleural fluid? Lights criteria. It will rule out Rice criteria is for exudative. So if they are not fulfilled, then it is transudative. Or if any other options were given, like ratio of pleural proteins versus serum proteins, so that you can share, or LDH levels. Okay, options were high proteins. Most likely pleural fluid will have high proteins. Proteins are high in exudative. Protein will be high in exudative. So if proteins are high, so that will rule out transudative as the cause. Okay, so this is the respiratory question. Chronic smoker with lot of bronchuria, especially in the morning, and sputum is yellow. and increases with the change in the position. What is the diagnosis? So, if options are, you can recall the option, you can put the correct options here.
Bronchiectasis, bronchogenic carcinoma, pneumonia. Okay.
All right. So, my answer here will be if chronic smoker history is being given, then I would choose bronchoria for bronchogenic carcinoma. That will be the correct option here. For bronchiectasis, the most important thing which will be given is a foul smelling three-layered sputum should have been given in that condition. Any other option for this question? Chronic smoker with bronchoria? Asthma does not have bronchoria as such. Okay, so what exactly was the question on Cartagena syndrome? Its features were asked, investigations or presentation. Okay, diagnosis was asked. So features of sinusitis, situs inversus must have been given for Cartagena syndrome. Okay, so that was a straightforward question on Cartagena syndrome.
Okay, patient with hypertension, increase ECTH even after high dose DEXA test. We have read this topic carefully. Hypertension, which is another very common feature of Cushing syndrome, increase ECTH either can be pituitary or ectopic. Since it cannot be suppressed with a high dose DEXA test, that means a negative response to that test goes in favor of ectopic ACTH producing lung cancer, most likely as a cause of Cushing syndrome. So the options were pituitary adenoma, ectopic ACTH, adrenal adenoma, or iatrogenic. Then you should clearly mark it as ectopic ACTH. Okay. Yeah. So we had one question on another favorite topic of in national board anytime is adrenal gland. Any questions similarly on Addison disease, adrenal insufficiency if you got?
Con syndrome.
No, options I think so were cons. Cons was given. That's adrenal adenoma only. Carter-Jenner is a classical question. Okay. So I believe it is a very balanced paper. They've touched upon everything. So we have got some question on acid-base balance also.
Must be कि कौन syndrome में क्या नहीं मिलता. So कौन syndrome में metabolic acidosis नहीं मिलेगा.
नहीं.
Metabolic alkalosis यहाँ पर होगा.
Hmm.
So I think that will be the option here. कि seen all except not seen. So we have till now 35 questions recall from medicine.
Good. And these are all pure medicine.
These are all pure medicine.
Pure medicine, not medicine fort or some path pharma Mahagathbandhan. It's pure medicine. It's not INDA alliance. It's all alone. Okay. So we have a 65 to 70 years old male patient whose fasting sugar is 140 and the postprandial is 200. Okay. So he falls into the diabetic criteria for diagnosis. What is the HbA1c target? As per the ADA guidelines, still it's has to be below 7%. Okay, so of the options, if they were given like 6%, 6.5, 7 or 8%, ideal should be less than equal to 7%. Basically, these two ratings have been given to you to reflect that it's a diabetic. Okay. Okay. Less than 7, Prince, yeah, it's a correct answer, less than 7. Okay. Now there's another question on Cushing. Patient with increased pigmentation, weight gain. Options include TSH, MSH hormone, or ACTH, or POMC. Can you elaborate this, Dr. Manvilan? Can you elaborate the options like increased pigmentation, weight gain is due to? The options would have been like this: MSH, TSH, ACTH, or POMC. I believe these would have been 4 sensible options, or cortisol.
ACTH was also in the option.
Okay. If there was an option like MSH, ACTH, because it's a precursor of ACTH as well as your MSH.
This question, child, I think it should be Pete's question on cystic fibrosis. So we can shift it to Pete's faculty.
Any other question?
Okay, I think we have got more than 35 questions recall. If there are other questions or any other options, you can put under the comment section of this video. This video will be there on the YouTube channel, Times Daily. So we'll gather all the information and we'll give you a correct recall as soon as possible.
Yeah, and please don't think that this exam is the end of your journey. Even if you have not done so well expect to your expectations, don't worry. It's not a competitive exam. It's just a qualifying exam. If you are just getting a good percentage, that's fine. You're passing is good. And people who are still in dilemma, what will happen and all, chill out for a few days, then we'll restart again. Okay, let the results come out quickly. And now there's another question. Patient with hypertension already on a calcium channel blocker and diuretics presents with hypokalemia. What medicine to add to avoid hypokalemia?
So I think if the options were given as potassium sparing diuretic, that should be replaced with thiazide diuretics. Thiazide causes hypokalemia, and potassium sparing diuretic will take care of hypokalemia. So if you can give the options here, so we can make correct answers.
Amiloride.
So amiloride is also a potassium sparing diuretic. If it was the only option, then you can mark this as the correct answer.
Okay, then
Furosemide not to be given. Furosemide cause hypokalemia.
chalo, okay, and I think so.
So we can wind up the session
now
because other faculty must be waiting.
And
All the very best for your results.
any other recall you have, any correction in the options, please do comment in the chat box or in the comment section below in this video. And very soon we'll be coming with a proper crisp recall on the entire medicine question being asked today. Okay.
Okay, all right.
So all the best. Keep on studying and be in touch.